Hello, welcome to our webinar on stress and burnout in home health care, cause, impact, and prevention, presented by Claire Barrett, William O'Brien, Claire Smith. First, I would like to talk a little bit about our Education Research Center. We're a center at the University of Cincinnati that aims to reduce most work-related injuries and injuries. Hello, welcome to our webinar today on stress and burnout in home health care, causes and impact and prevention, presented by Claire Barrett, William O'Brien, and Claire Smith. I first would like to start with a little bit about our Education Research Center at the University of Cincinnati. Our mission is to reduce work-related injuries and illnesses by performing research and education, and specifically, we're targeting home health care. We're sponsored by the National Institute of Occupational Safety and Health, and we have a webinar series that you'll be seeing in the future on home health care. Part of this mission is to have targeted research training where we are conducting research in home health care. We're trying to identify the hazards that workers encounter that we can then provide interventions. You may also look to get information at our website, our blog. We post information about various research as well as events. You can provide us your email. We can get you hooked up with our circle, our social media initiative. We're on Twitter and we're also on Facebook. So let's get back to our webinar currently, and I'll turn it over to Claire, William, and Claire to present about this. I would also like to tell you about a survey that we're doing on stress, burnout, and home health care for home health care workers. We need volunteers to complete a survey at this website link, and it's all about stress and burnout. And if you participate or have your employees anticipate, we can provide you the research summary at the end of it. We also are looking into contributing to donations for home health care PPE. We're asking agencies to provide us with their needs, and then we're soliciting donations, and we'll distribute soon those supplies that we find. Please, after you watch this webinar, please complete the evaluation of the course at this link, and it helps us refine what we're doing in the future. Thank you for attending the webinar.
All right, so as Kermit mentioned, my name is Claire Smith. I research work stress, how people respond, and today I'm going to be talking about the impact of stress at work, the good, the bad, and the really, really bad. So what is stress? Stress is that psychological feeling of tension and pressure that happens when your work demands something of you. Maybe someone was rude to you at work. That creates stress. Maybe you're not sure what you're really supposed to be doing. That creates stress. Maybe you just have a crazy amount of work to do, right? All of these things create stress at work. And we all know what stress feels like. It feels bad. But what most of us don't realize is that there's actually a reason behind the ways that we react to feeling stress. So our minds and our bodies, there's a purpose that can sometimes be helpful. Pretty bad. But what I think a lot of us don't realize is that there's actually a reason behind the ways that humans react to feeling stress. So for example, let's say you have too much work to do. Everything's really piling up. It's feeling like more than you can handle. Feel stressed. Stress is our body's signal to itself that there is something happening around us that requires us to adapt. We can't stay at our baseline state of just calmly getting things done, right? We have to adapt. We have to actively do something to deal with this stressful circumstance. So our body and mind react to the stress in a variety of ways. For example, your heart rate might increase. You might find yourself having repetitive, ruminative thoughts about the thing that you're stressed about, really focusing on it. And then there are some things that are happening that are kind of outside of our conscious knowledge as well. So your body releases hormones such as cortisol. And although we're generally thinking of stress as this unpleasant negative experience, it can actually serve a helpful purpose. These changes that are happening in our mind and body ready us for action and can help us recognize and deal with the stressful thing that's happening and actually reduce it. So for example, your increased heart rate can help you do things more quickly. Those repetitive thoughts you're having about that stressful circumstance can help you focus on the problem at hand and rule out any external distractions. And then hormones like cortisol can help you stay motivated until the stress is gone. So these reactions are triggered in our body by stress for the purpose of actually helping us reduce stress. So when we think about all the work that we have to do in that very stressful work week, your increased heart rate, your feelings of anxiety, your mental focus only on that one stressful thing actually potentially could serve the purpose of having you better deal with that stress and reduce it. So stress can be helpful for us to recognize when we need to take action and actually help us take that action. But I think from a personal anecdotal standpoint, we can all recognize that stress doesn't usually feel helpful. And I want to talk about why that is. So the human body, the human mind is pretty resilient. We can react to and respond to any given instance of stress usually pretty well, even a few instances of stress. But when we think about modern work and our experiences with what that looks like, there are so many things, so many stressful things that can happen over the course of any given day. So it's not a matter of one stressful thing happens, you can deal with it, you're equipped to deal with it. It becomes very difficult when stress starts to become a pattern at work rather than the exception. So that's really describing chronic stress, when things are piling up. And the body's emergency responses that can often be helpful in letting us recognize and deal with stress. Those changes in hormones, heart rates, feelings of anxiety, those responses are not meant to be sustained over time. If stress is chronic in your life, at work, you're really calling on those emergency response systems more often than their capabilities will allow. So the question then becomes, what happens if we're in this emergency state all of the time, right? Because our job is very stressful. This is kind of the so what portion of this presentation. It's a question of, is feeling stressed just the same as feeling worried, or are there actual larger implications that we really need to be paying attention to? And I'll go ahead and spoil the answer to that question. It's the latter, right? There are a lot of very important implications of work stress, I think beyond what a lot of people really recognize. So first of all, chronic stress means you won't be able to perform your best at work. If you're exhausted and depleted from being in this emergency state all of the time, you can't focus on your work and you can't put your all into what you do. You certainly can't be highly creative and try and solve problems in new ways at work. You just don't have the energy and motivation because you've devoted those things to dealing with stress. Additionally, because of all this physical and emotional exhaustion, you're actually more likely to miss work due to illness. You're more likely to get sick pretty often. And so you can't do your job well if you're not even able to show up, because that's where your level of stress is. And then finally, Sometimes when a job places us in stressful situations repeatedly, we can start to feel some level of resentment towards the organization that put us in that circumstance in the first place. And so some counterproductive behaviors can manifest as a result. So, for example, if you feel like your organization is constantly making you feel stressed, you might not be that worried if you're arriving late sometimes. You might find yourself being more irritable with coworkers, clients, etc. So really, we can see that stress is hurting your ability to be the best employee that you can be from a variety of different directions. And then I would argue, more importantly, stress is also damaging to you as a human being, right? In the home healthcare field specifically, you have the very important job of caring for other people's well-being. And unfortunately, if the job involves a lot of stress, it might be at the sacrifice of your own well-being. And that's really not okay. And I want to emphasize the really important ways that this can happen. So when your body is tense all the time, it begins to have a lasting impact on your physical health. You might get headaches, neck aches, back aches, and even experience more illness because your immune system becomes weakened when you're constantly exposed to stress. Your mental health might suffer as well. So there's a lot of research that shows when you have chronic work stress, it's related to greater symptoms and diagnoses of mental health issues like depression and anxiety. Unfortunately, stress can also increase your likelihood of developing serious physical diseases as well, so things like type 2 diabetes and cardiovascular disease. And the way that happens is stress is disrupting the regular healthy functioning of your body. It's stopping you from engaging in healthy behaviors like good sleep, good eating, regular exercise, right? And over time, again, if this stress is a pattern, it's chronic, those can accumulate in the form of these serious diseases. Okay. Unsurprisingly, stress can also distract you from family matters, from your personal life, and it can lead to lower life satisfaction overall, so decrease your happiness. Clearly, high stress levels can impact us in a variety of ways, both at work and beyond. But one final big long-term way that stress can impact us that I really want to highlight today is burnout. Burnout is a term that I think we see a lot, but what does it really mean? So eventually, when your work is highly stressful all of the time, it's taken a toll on your health, it's taken a toll at your job, you can become burned out. So burnout is a psychological syndrome that results from chronic stress. And it involves three main symptoms, and we're going to talk about them a bit to kind of help you recognize what's really involved in burnout. So the first symptom is emotional exhaustion. You're putting in so much emotional investment, so much energy into your job, into helping other people, that you feel spent, you feel completely exhausted, and like you just have nothing more to give, right? This is more than just feeling tired after work one day, or even tired for 1 week, right? This is a constant extreme state of exhaustion. The second symptom is called cynicism and involves mentally detaching yourself from work. So you're no longer finding joy in what you're doing, no longer finding meaning. You don't really see the point in what you're doing. So cynicism is really all about a pessimism towards what you're doing and mentally checking out. And then finally, the third symptom is professional inefficacy. And professional inefficacy is really just self-doubt at your job. It's the perception that you are no longer good at what you're doing. Okay, so overall, burnout is when you are constantly feeling that you are completely drained, you're no longer invested in what you're doing, and you're no longer doing a good job. I really like this quote from a researcher at Texas Tech. I think it clearly demonstrates the difference between even a pretty high level of work stress and burnout. So I've talked already about the damage that a high level of chronic work stress can cause, but it's not the same as burnout. Burnout is a really extreme escalation, right? So stress is the person who looks a little crazy when they turn up for an after work get together, they're strung out, they're frazzled. Burned out person is the one who didn't even bother to show up at all. It is incredibly important to notice when stress becomes a pattern for you at work, because you do not want it to get to the point of burnout. There are still ways to come back from it, and we're going to talk about kind of a solution-focused approach, how you can come back from it. But it's harder once it reaches the state of burnout. So it's really important for your health. It's really important for your work that you understand what stress looks like. That's damaging in and of itself, but also that you understand what burnout looks like, so you can recognize it if you feel like it's happening to you. Overall, we've seen stress can serve a purpose. It can help you adapt to demanding things that are happening around you and actually reduce that stress effectively. But if it's something that you're experiencing all of the time at work, please don't ignore it. It's not just an unpleasant feeling, right? It stops you from getting your work done, and it's related to a variety of very serious health conditions, both mental and physical. And if it goes unchecked, it can lead to burnout. Right, so that is the good, the bad, and the really, really bad of work stress. I am going to go ahead and hand it off to Dr. Claire Barrett to give you some more information contextualized to home health as a profession.
Okay. Is there a way to transfer the host to me so I can share my screen?
Jessica, am I able to do that, or is that?
Kermit, if you right click on Claire and make her the host.
Okay, can everyone see my slides okay?
Yes.
Perfect. Okay, well, thank you, Claire, for that overview of stress and how it can turn into burnout, and kind of really allowing us to really contextualize what stress is and how impactful it is. I apologize for any confusion as we transfer from one Claire to another Claire. It's how it works around here. But my name is Claire Barrett, and I am a faculty member at Bowling Green State University in the Industrial and Organizational Psychology program. As an IO psychologist, my work focuses on examining how both individual and organizational performance, health, and well-being can be improved. So, as Claire just outlined, occupational stress can have a monumental impact, not only on individuals, but on organizational functioning as well. So as a result of all this, I wanted to take the next 10-15 minutes to really focus on, well, if we know how impactful stress is, well, we need to try to attack it and try to reduce it. And the only way we can do that is by identifying the most common sources of stress within healthcare, and more specifically, home healthcare. And so for those of you working in home healthcare, a lot of what I'm going to present is probably not going to come as a surprise to you. You live this role every day and know firsthand the stressors that come with it. However, I do want to note that a lot of what I'm going to cover comes from research examining stress in healthcare in general. Okay, and so what I mean by that is a lot of what we know on stress in healthcare comes from research that looks at it very broadly. So as nurses as a whole, what does stress look like? Or what does stress look like for medical students or for physicians? While there is research out there that dives into a little bit more specifics in terms of areas like home healthcare or within units such as ER nurses, those studies are just less common. So again, today I'm going to be focusing more broadly on what are the most common sources of stress within healthcare, And just note that, so some of these stressors may not always apply to home health care, and also there might be some stressors that are unique to home health care. Okay, but again, I'm just going to be focusing on the most common stressors, and then at the very end, I'm going to briefly touch on what are some things that organizations can do to try to help address and hopefully reduce stressors in the workplace. Okay, so let's just jump in. This probably will come, again, for those of you that work in healthcare, and especially home healthcare, you will not be surprised by the fact that the most commonly cited and referenced stressor within healthcare as a whole is understaffing. Okay, so the workload that home healthcare workers and healthcare workers in general undergo is monumental. And especially when we go through economic times where we're cutting back on resources and having to maybe put employees on furlough or let go of certain employees, that just increases the workload for those that remain. So understaffing, which inherently increases the workload, is the #1 referenced stressor across all areas of healthcare. It may be a little less relevant to home healthcare. It really kind of depends on the organization that is operating. But shift work is another monumental stressor for those that are doing shifts that are beyond the normal 8 to 5. So routine shift work leads to, your body getting out of its normal cycle. You're also losing contact with family and friends. And it increases just more, not only stress, but more conflict in your life in regards to your family and personal matters. And then specifically within healthcare, a massive job demand that comes up routinely are just the physical demands that it takes to be a healthcare worker. Okay, so it's not just the fact that you're working long hours, it's that you're lifting patients, you're using large equipment, you're using physical or aids that require very technical skills and acute attention. Okay, so when we think about physical demands of healthcare, it comes down to, all the physical requirements of lifting and transitioning patients, as well as you're on your feet a good portion of the day, as well as dealing with potentially harmful bodily fluids, medicines, transporting those medicines and fluids. It all just kind of comes down to the organization that you're functioning and working with. But the physical demands are the leading source of injury that leads to turnover down the road. Okay, beyond just the typical job demands of just what it takes to be a healthcare worker in terms of the physical and the mental pressure, time pressure routinely comes up over and over again, where a lot of healthcare workers, especially nurses, acknowledge that they just simply don't have enough time to address all of their patient needs. So especially when we're understaffed as an organization, you're trying to, as one single healthcare worker, attend to more patients. So you're not only dealing with struggling to use the time you have to address all of your patients' needs and questions in the allotted time you have, but now because you have more patients, you have less time between your patients, and you're having to constantly switch and thinking about each patient that you're dealing with and who you're going to see next, and make that mental switch back and forth to ensure you're providing the appropriate care. Okay, so time pressure is a massive issue where, again, research shows individuals that go into healthcare go into it because they truly care. So healthcare workers want to give the time and the proper care to their patients, but they're constantly having to battle that desire to provide adequate care with the amount of time they have to do so. As we'll talk about a little bit later, now with COVID-19 happening, that time pressure is becoming an even bigger issue because due to all the cleaning, there's just simply less time that we have in the day to address everything that needs to be done. And again, this shouldn't be surprising. Healthcare comes with it a ton of emotional demands. And like I just said, individuals that go into healthcare go into it because they truly desire to help others and provide that care. However, along with that desire comes with a lot of emotional labor. So the 1980s and 90s saw a big cultural shift within the world of healthcare where we shifted away from encouraging healthcare workers to distance themselves emotionally from patients to a more holistic approach, where we're encouraging healthcare workers to form a relationship with their patients. And the more that this relationship develops, the more the emotional demands develop. So emotional labor results when you have this relationship, or even when if you're having a really rough day, there's a lot of things going on in your personal life or with your family, and you're very distracted, you can't let that show to your patients. So you're constantly having to shut down your emotions, put on a happy face to ensure that your patients are getting the care they need and that they are satisfied. Okay, so there's a lot of constant going back and forth mentally, and it's very laborious to switch back and forth to meet their needs while controlling your emotions. And that's especially hard when you think about within healthcare, you're dealing with death and illness on a regular basis. Okay, and that's a heavy subject to deal with. So it has a large toll emotionally and eventually psychologically over time. Okay, and some research has shown that the more that we develop these personal relationships with our patients, it actually results in less objectivity. All right, so it's a concern for a lot of organizations of, we need to be developing and encouraging you to develop these relationships, but while maintaining a certain distance so that you can maintain your objectivity to provide the adequate care that is needed without getting too caught up in it and letting your emotions take over. Another big source for stress across all jobs, but specifically in healthcare, is interpersonal conflict. And again, this may or may not be as big of an issue in home healthcare. It really depends on the organization you're working for and where the patients are that you're providing care. Interpersonal conflict can arise from any source. It can come from your patients, it can come from your patients' families, it can come from your coworkers, it can come from your leaders in the organization itself. So interpersonal conflict is just dealing with, so depending on what your patient's illness is, if you're dealing with an older patient who's maybe a little less cognitively aware, they might not know who you are, or they might be scared of what you're doing. They may not understand the type of care you're trying to provide, which can result in harassment, can result in physical and verbal assault, such as biting, hitting. And on top of, you're also trying to deal potentially with patients' families. And again, patients' families, depending on the illness of their loved one, they can also be very overwhelmed and very stressed throughout this process. And that can lead to some conflict if you're trying to communicate the needs or they disagree. There can be some instability because they're overwhelmed themselves and they take it out on you. So there's a lot of conflict that can go back and forth between the healthcare worker and their patients, as well as the patient's families. A big source of interpersonal conflict is also with coworkers, and this is actually a big area of research within the nursing field, is nursing is fraught with bullying and incivility behaviors. Again, depending on the type of organization a home healthcare worker is employed with, this may or may not be as big of a concern because they may not be interacting with coworkers on a regular basis, like if you were a nurse in a hospital type setting. But it is still a concern because it has a large impact on stress, how we react to stress, how supported we feel, which then down the road leads to our commitment and turnover behaviors. And again, another common source of conflict comes from leadership. If you have a supervisor that maybe isn't the best at communication or doesn't maybe is really good at their job, but less so in leadership role. So abusive supervision can happen. And again, it just kind of comes down to how much interaction does a home healthcare worker have with others within their organization. But if you are in an organization for home healthcare that maybe has a little less day-to-day interaction with other providers, this actually causes, so maybe you have a little less interpersonal conflict with your coworkers and supervisor, but this would actually lead to another source of stress, which is isolation. So social support has been found throughout the research literature to influence the experience of stress. And what I mean by that is social support has really been shown to kind of protect individual workers from the negative health effects of stress. When you have someone that you feel cares about you, supports you, that you can lean on, that helps to buffer the negative effects of stress. If a home healthcare worker is routinely going to patients' homes on a daily basis and doesn't have any coworkers to provide that social support, that sense of isolation and lack of support can actually exacerbate the experiences of stress. And then just how our organizations are structured and the policies and practices we put into place can be a source of stress for home healthcare workers as well. So when an organization has a lack of involving all workers in decision making, that can lead to lower perceptions of empowerment, where they don't feel their voice is being heard. And the research in most organizations acknowledge that we can't necessarily, for every single decision, include all employees and get their voices heard. But if they can't be involved in the actual decision-making process, a way to get around this stressor is to actually then maybe communicate, how is that decision made? How is it going to affect all workers? Communication is key here, and a lack of communication can really lead to a strong sense of, I'm not supported, they don't care about my voice, which again leads to more stress and over time, a sense of burnout and kind of tuning out. And also a commonly cited stressor throughout kind of the more nursing level is actually a lack of rewards and acknowledgement. And again, if you're a home healthcare worker where you're going from patients' home to home to home and not maybe going into an actual office setting on a regular basis, it's really hard to get that acknowledgement and that sense of like, thank you for doing a great job. What you're doing is a little less seen by your coworkers and by the organization, so it can actually convey a sense that you're not being valued. So with fewer rewards and fewer kind of forms of acknowledgement, the more stress that can arise. And then what is particularly unique about home healthcare is the environment itself is a source of stress. So anytime a healthcare worker is going into a patient's home, you're potentially faced with physical hazards, biological hazards, poor air quality, on top of the fact that you're commuting between patient homes, which inherently puts you at risk anytime you get into the car, not only at risk of an accident, but also for air pollution, which is a growing area of research. Right? So the environment itself of our patients' homes can be a stressor in that you may be trying to provide care in a physical environment where it's cluttered with furniture or it's hard to access various equipment that you need. Or because you're in a patient's home, any aids that you have, so maybe equipment that helps you to lift a patient, it's hard to use that in somebody else's home if it's crammed, so you just may not use it, which can also increase levels of stress and actually physical injury. And I think it's important to kind of note that, so there's a lot of sources of stress within healthcare and home healthcare, but now that we're in this pandemic, COVID-19 is increasing the impact and maybe kind of enhancing and introducing new sources of stress. So we talked about how going into patients' homes itself is a stressor and can be hazardous. Well, now within the pandemic and COVID-19, that's actually increased. So we're constantly not only trying to provide care in an environment that might be physically or biologically hazardous, but now we're constantly thinking about protecting ourselves from our patients, and more importantly, protecting our patients from ourselves, especially if your patient is of an older generation that might be in the high risk category. You want to make sure you're not bringing anything into their home. So safety and being aware of all the safety concerns and keeping your patients safe is a massive stressor in the last 3 to 4 months. Also, time pressure. As we're trying to think of safety and keeping our patients' safety needs constantly in our awareness, it requires a lot more cleaning. So making sure our equipment is clean, making sure our masks are clean. Well, anytime we're devoting time to cleaning to maintain the safety of the patients, that's taking up time. So that's now increasing the time pressure you face from going from patient to patient to patient, ensuring you give them adequate care, cleaning appropriately, and getting to your next patient on time. And something that's actually really growing in the psychological literature right now is actually decision fatigue. So we're constantly, whether it's through the news, through our jobs, we're aware of the impact of COVID-19. And so we're constantly having to decide, is it fair, is it ethical for me to go to work? Am I constantly, do I feel ill today? What are the ethical considerations of me going to work versus not going to work? If I do go to work, do I put my patients at risk? We're constantly weighing decisions on a daily basis that are based around safety and ethics. And that constant deciding of what is fair, if I go to work today, what's the impact if I accidentally bring in, germs to my patients? Or what if there's germs in my patient's home? What are the risks of me bringing that home to my family? So making those decisions over time leads to decision fatigue, where you're constantly inundated with weighing the pros and cons of various behaviors related to your job. So I'd like to kind of end on what can actually be done about this. And again, as an IO psychologist, I mainly focus on the workplace. So I'm not a trained clinician. I don't have any licensing to provide any kind of therapy or counseling. But our field likes to focus on intervention and what can we do to enhance the workplace and give employees the right tools. So thinking about, if we know the common stressors found within healthcare, what can we do to help address that? And so obviously the first one that comes to mind, it's come to mind for the last, 30, 40, 50 years, is we need to decrease demands and increase resources. And the biggest demand is workload. So we talk about this all the time, that we need to ensure adequate staffing levels. That's a common problem that's talked about every day, yearly. And unfortunately, it's not always the easiest one. We have a limited amount of resources, and it may not be possible, but that is the number one ideal, is we need to get adequate staffing within healthcare to ensure not only safety for patients, but safety and well-being for the healthcare workers. In an ideal world, we would also encourage increasing the pay of healthcare workers. We want to make sure they are being adequately paid for the work and the importance of the work that they are doing, so that they feel they are valued and that they're not tempted to leave the field for a better paying job elsewhere. Okay, and also, we want to make sure there's equity in allocation of shift schedule if there's an organization that uses shift work. You want to make sure it's kind of equally distributed and that it's fair, and how it is determined is communicated with workers. Also, it's not important just to decrease demands. We need to increase the resources available to healthcare workers. So again, that's increasing pay, but also providing access to support resources. So that could be just access to literature, or it could be access to counseling. So for healthcare workers, if you're dealing with the sick and dying on a daily basis, that can be taking an emotional toll on you. And counseling can be a vital resource to help work through that emotional labor. Leadership and management also play a key role in managing stress. So a lot of research kind of examine leadership styles. So transformational leadership style has been linked to increased group cohesion, increased sense of social support, and increased empowerment amongst employees. So we need to think about ways of enhancing and training our leaders and our management better to make sure they understand what a good leadership behavior style is and how they can practice that, and make sure they lean away from the more common kind of transactional leadership. Transactional leadership has actually been linked to stress and burnout. So the more we can train leaders on how they can communicate better, how they can model and challenge their employees, the better it's going to be linked to stress. And a key source that you can never get enough of is training. The more training we can provide healthcare workers, the better. Okay, so we want to make sure all healthcare workers have access to regular training that increases or maintains their knowledge of healthcare and the skills that they need to do their job. Okay, so this could be training on the use of physical aids, equipment, new medicines, you want to make sure that your healthcare workers have the skills and knowledge they need to make the decisions on the job on a regular basis, and that they feel that they have the empowerment to do so and the confidence to do so. Because as Claire talked about, kind of the lifelong as stress progresses and starts getting into burnout, you kind of have this sense of decreased confidence in your skills and abilities. So we want to make sure healthcare workers have the necessary skills and knowledge to feel that they are prepared and able to do their job. Okay? And because home healthcare workers interact with patients and patients' families and potentially coworkers on a regular basis, training on adequate communication would actually be very beneficial so that they feel they have the skills necessary to appropriately interact with their patients and their patients' families, and that they feel they have the support to do so. And again, we cannot reiterate enough, stress management training is key here. If you want to attack the stress levels of our healthcare workers, provide them with training that gives them the skills and the knowledge to address their levels of stress themselves. But a key thing I should note here is through the decades of research on organizational change and the impact of training in organizational settings, if the leadership doesn't support the change in behavior, it's never going to be effective. Okay, so if we're going to change the organization to provide more training, to provide more resources and access to counseling or resources to deal with stress, if the leadership doesn't support that or gives off any kind of messaging of, well, it's available, but whatever, it's not important or it's not useful, no one's going to need to take advantage of it, and it's not going to be particularly useful. And that training is, for the most part, going to be very short-lived. So you need to make sure if you're trying to make any organizational change, you need to get leadership buy-in and they need to support it and talk about it regularly. So maybe they constantly talk about in emails to their workers, we have these resources available. So I highly encourage you to use them and send that message out on a regular basis. Okay. But I do think it's important to note that addressing and lowering stress in home healthcare is not an easy or quick fix. Okay? So research has shown organizational measures to reduce stress for healthcare workers are likely to have limited impact, especially in the short term. Okay, so this is never going to be a quick, easy fix. Okay? So the small kind of impact is really kind of partly due to the limitations of a lot of interventions, but also that stress perceptions are not universal, meaning what I perceive as stressful may not be perceived as stressful by someone else. Okay, so stressors vary from worker to worker. Okay, and further, the workplace is never static. Okay, stress can vary over time, and that's important to constantly think about if we're going to address sources of stress and try to change it. We need to understand that all of our workers are different and stress changes over time. Okay, so it's important to consider just how individual workers might be supported, enabling them to utilize the most effective coping strategies that work for them as individuals, supported by colleagues and senior staff. Okay, and again, it's key to note that this is not a short fix and it's not going to be an easy fix. Healthcare is a stressful occupation, but the more we can reduce stressors in our ability, the better off our field will be, and the more you're going to get out of your workers. But those are just some things that an organization can do. Dr. Bill O'Brien's actually going to talk about what are some tactics or strategies that individual healthcare workers can use to address their own stress levels.
Okay, thank you, Claire. Is there a way that I can, put my videos up, do you know? I don't know how to do this.
Okay.
I reclaim host role.
Claire, did you switch it to him as host? I think you got it right close. I can't switch it now, so you got to declare him as host.
Okay.
Right click on him and change him.
Should be coming your way, Bill.
Oh, okay. Oh, hey, I think it's working. Okay. Is that visible? Great. Well, thank you everyone for allowing me to participate in this panel. I think this is a really important time to be talking about the issues that have been brought up here today. A quick introduction. My name is William O'Brien. I'm a professor and the director of clinical psychology program at Bowling Green State University. My research area is in clinical health psychology and also what we call contextual behavioral science, which is kind of contemporary models for cognitive behavior therapy. Dr. Barrett and I have worked together on a number of projects related to predicting injury and psychological and physical injury in a long-term care focused on nurses and nursing aides. So we've learned quite a bit over the years on factors that predict it, and we've also done some intervention work to identify ways that it can be improved. Beyond that, I do research on mindfulness and mindfulness-based treatments for psychophysiological disorders. And lately, we've been doing some research on COVID-19, how people are reacting to COVID-19, both here and in Asia. So I'm going to do a bit of an overview here about why the current context, the overall social context that we're in here is really important for understanding why workers may be distressed. And this will also lead into the theoretical models that I think guide interventions for stress and occupational stress in particular. So going back, being worried and distressed is normal under ordinary circumstances. Humans are a very skittish species. We were evolved to be that way. It allowed us to survive. If you think about it, we don't have claws, we don't have fangs, we're not really that fast. So the way we survived for hundreds of thousands of years was through being very, very good at detecting threat and escaping and avoiding threat. Fighting against threat was only a last resort intervention. I liked this slide only because I often think that if we were hawks, there would be no psychologists. Hawks do not have fear. They didn't evolve to have fear. They're a predator, and they don't have much anxiety. So they would never go see a psychologist. Whereas we're much more like the human sandwiches here. We need to be aware and vigilant in order to survive. So our ancient survival skills really were organized around being vigilant, being aware of possible threat, avoiding threat and danger whenever possible, and then escaping. And if escape was not possible, then fighting. And the only sort of variation to that rule was if it was a human threat. If it was a threat from a human, then the situation became more complex because at times you had to confront the other human in order to maintain your social standing. So escaping from a saber-toothed tiger provided immediate relief. Running away from a confronting other human brings shame sometimes. So we react very differently depending on if the source of threat is another person versus a non-human threat. The thing is, this system of threat detection and escape and avoidance has no off switch. We do it constantly without thinking. It's automatic, and we cannot escape from it. And this will be a little bit of an outline for something happening later, which means when we're doing therapy or interventions targeting fear, threat, stress, we really can't promise or even target the idea that we're going to make it go away, that we're going to help you control it. There is no off switch, so it's not a matter of control. This slide here, I think, again, illustrates the differences among two species. The dog can appreciate the walk. The human, with language, can turn a walk, a simple walk, into a series of threats, financial threats, interpersonal threats, worries of various natures. And there's one threat that seems to rule all threats. One fear that rules all fears is uncertainty. In laboratory studies, it's been demonstrated that people will prefer predictable, reliable shock over uncertain, unpredictable shock. Meaning uncertainty in and of itself is a threat. So here's our situation now with COVID. We're in a life circumstance now where there is an invisible, undetectable, potentially deadly threat everywhere. You can't see it and you can't detect it. So where do you run? What do you fight? And in America, this uncertainty has been amplified by communications from the government and the media, which are highly contradictory and at times harmful and malicious. There's political aspects that have been put into this mix right now that are creating conflict and blaming. And then the blaming allows you to identify enemies that you can fight. And then finally, scientific findings, which have been remarkably consistent on this virus. If you look from the earliest days of the research to now, there are consistent messaging coming about the relative risk and the things that can be done about the risk that have been encouraged by some sources to be ignored and to be discounted. So you can imagine that you and many people like you are in a really difficult situation. High threat, deadly threat, inconsistent information, no safe place to run, and no clear guidance as to what you can do to solve the problem. This is a potent mix for stress at a societal level, and that will interact with anything going on in an organization. So we have the scientists providing information, and then we're getting misinformation. Think about all the times in the last few months you've heard the word death, deadly, skyrocketing, apocalyptic. We are all living in a time right now that would be considered to be optimal risk for developing post-traumatic stress disorder. Killer virus spreading fast. You've all seen this. You've probably looked at it dozens, if not hundreds of times. So the idea here is you should be feeling distressed. And in our research domain, we study mindfulness and mindfulness-based interventions, and many people think that's organized around making stress go away. That's really not the case at all. In fact, it's opposite. We do not focus on eliminating, controlling, or fighting distress. And in fact, we think that these strategies are harmful because they inevitably fail. And I want to take a moment here to kind of give the theory behind this. Here's the scenario. I can ask anyone who's viewing this video to imagine a situation. I put you in a lie detector machine like this one, and I give you the following scenario. I say, hey, what I'd like for you to do in the next 5 minutes is not think a single negative thought. I don't want you to think a single negative thought or have a negative emotion. And to motivate you, I'm going to have this polygraph machine which can detect the slightest negative thought, slightest negative emotion. I'm going to have it attached to a large voltage device that will kill you. You'll be delivered a fatal electric shock if it detects the slightest negative thought or negative emotion. What's going to happen to you? If you're like me, you realize at a deep level that you will die instantly or very close to instantly. The minute that procedure starts, you will think a negative thought. You will think, you'll have a negative emotion. Now, why this is important is if you think about it. When your life is on the line, you recognize that you can't control what you think and feel for seconds, for a few minutes. So imagine how unworkable it is for an employee or a client that I see to come into therapy and say, help me get rid of my negative thoughts for life, or to make this bad feeling I have go away for the rest of my life. If you can't do it for 5 minutes with your life on the line, you're not going to be doing it anywhere else. So we cannot seemingly at will control thoughts and feelings. This is an important thing to contemplate when you think about mindfulness and interventions. Why is this the case? And I'll just take a few minutes on this. Standard learning theory and language have developed now to form new ways of thinking about the mind and new ways of thinking about therapy. It's a paradigm shift. The idea is that under normal conditions, we react, we have learning, classical and operant conditioning, to environmental stimuli, but because humans can think in terms of symbolic reasoning, we can substitute thoughts or words for reality and react to those equally to real world experiences. So we can be reacting to things we see objectively and experience objectively in the world, or we can react to events that are created by our mind, and we react equally to both. So this is the formation of stress, and it's related to relational frame theory. Here's an example. Here's a beautiful lemon. And this lemon has formal properties: color, shape, size. You can smell it, you can hold it, you could touch it, and it's a beautiful lemon. But there are arbitrary properties of a stimulus that we assign based on experience, language, or social rules. So the arbitrary properties of this object here is that we give it a name, lemon, or if you're in China, it's called Ning Meng. We give it a symbol, Chinese symbol. These sounds and symbols are arbitrary in the sense that they don't have any connection to the object, really. They're just arbitrary sounds that we assign to this object. Humans are really good at this, and it's the foundation of language. So here's the way it works. When you are a child, or if you have a child, maybe the child sees this object, and then the parent will say, well, that's a lemon. So the child hears the sound lemon, and connects it quite readily to this object. Then maybe the parent says L-E-M-O-N, another set of arbitrary stimuli, just visual stimuli, goes with the sound lemon. So the child has been taught two things. This object goes with this sound, and this sound goes with these letters. Now here's something that only humans can do. Later on, you might show the child this object and show him a series of letters, and the child will connect these letters to this object. No other species we know of can do this. This is called relational frame learning. So quite quickly and quite automatically, the child learns this goes with the sound goes with these symbols goes with this object, and we do this quickly and automatically, thousands and thousands and thousands of times. There's two things that are important about this. Once you form these relationships, they're relatively permanent. It would take a lot of therapy for me to try to teach you to see this object and think not lemon. I don't think I could possibly do enough therapy. You will see this object and think lemon. So if you see this object so the idea is we can add infinite arbitrary relationships with this object. Not only can we call it a lemon given a sound, we can say it's a good or bad lemon, a fresh, happy, warm. We can assign many, many different properties to this. And the point is, once these relationships are formed, they're permanent. The human mind is like an adding machine or like a calculator that has no minus sign. I want to take this out. So the idea is you can form new arbitrary relationships. You can form concepts, but you cannot seemingly remove concepts without some kind of brain injury happening to you. So we're constantly adding connections, forming associations, but we can't get rid of them. So the meaning of lemon differs from person to person. And the meaning of lemon is derived from these arbitrary processes. Now, we do this without effort, we do it automatically, and we do it with everything. We do it with self, others, thoughts, feelings, work, objects, careers, everything. So you all have formed a relational frame about me. It's a Chinese symbol for I. Me fat, me smart, me dumb, me good, me bad. You form these associations across time just as you did with the lemon. And the point is, once you form these associations, they're relatively permanent and they're not going away. You also formed associations with you and others. You formed associations with the concept of COVID-19. Good, bad, right, wrong, fatal. The idea is that you're reacting to these constructions, not the stimulus itself, but you're reacting to your construction of the stimulus. And this creates the possibility for suffering. It also means that we have a hard time finding solutions to our problems and why we have unhelpful solutions that we try over and over again. So what we can and cannot do, humans can very effectively use language to solve problems in the outside world. We use language to build bridges. We use symbolic reasoning to plan. But when we take those same skills and try to use them to solve internal problems, they don't really work. As mentioned, we can't make ourselves not think of a bad thought for 5 minutes with our life on the line. Similarly, we can't control any other internal process that we have, whereas we can very effectively control external processes. So if I don't like a piece of paper or this piece of paper here, I can crumble it up and throw it in a garbage can and it's never seen again. It goes away forever. The mind tries the same thing with a negative thought about myself being inadequate. It tries to crumple it up and throw it away, but the internal world doesn't operate under the same principles. The paper comes back. I throw it away, the paper comes back. I throw it away, the paper comes back. So we're destined to fail. So language is a source of ascendance as a species, and it's a source of our suffering too. I like this picture because a dog can eat a hamburger, take a nap. A human could take the same delicious hamburger and turn it into a source of suffering. Say, oh, I feel fat now. I feel like I shouldn't have eaten that. I have poor impulse control. We can take something very beautiful and happy and tasty as a hamburger and make it a bad thing. That's uniquely human. So, research-wise, this is important because we know that people react more to the anticipation of a stressor than an actual stressor in the lab. We do this all the time in our lab. We know that if we're measuring heart rate, we will show a greater reaction to telling someone they're going to take a test than actually taking the test. We've completed a study just now on COVID-19 and US population, trying to determine who was going to use PPE, a mask or not. Objective risk, obesity, illness, medical, all the things that would be good reasons to use PPE were not predictive of mask wearing, but perceived threat and uncertainty or intolerance of risk were predictive. So again, the idea here is PPE use is not really a logical response in people. They're responding to their internal construction of whether or not it's a good idea, which is not related to their objective risk. In fact, objective risk in our study was inversely correlated. People who were more sick, older, and less, older, more ill, more mal, were less likely to actually engage in protective behaviors. So what can we do about this? Well, a typical coping model is that we have a stressor, an appraisal, and responses. The stressor is caregiving. A negative appraisal that creates stress might be, this is too much. I can't handle it. I can't take it. This will produce physiological activation, the stress response that Claire, the first speaker, talked about. It can also create decisional avoidance, thinking about other things, distracting oneself, and it can create overt motor responding. The problematic appraisals are what we focus on in interventions mostly. Things are like, I can't take it, it's too much, it's unfair. Albert Ellis suggested that when you're generating these sorts of communications to yourself, you're masturbating and shitting all over yourself. Ellis had a great sense of humor, but the idea is like, I have to do this, I've got to do this, I shouldn't do this, I shouldn't do that. These are all internal representations of the world that create stress. Note, it's not the stressor itself, it's not the caregiving that's creating the stress, it's the appraisal of the caregiving. So the idea for stress comes from this notion of cognitive fusion. We mix up thoughts with real world events. We don't look at our thoughts, we're looking from our thoughts. For example, call light goes on. That's all that's objectively happened in the world of a nursing aide. The call light has gone on, indicating that a patient needs help. The nurse or nurse aide might add to that, I'm too busy, this is unfair. That is not being generated by the light, it's being generated by their mind. And so when they react to that light, they're reacting not only to the light, but their own evaluation of the light, and the physiological experiencing of that is both. And this happens all the time. Claire Barrett mentioned being short-staffed. That's a great example. You can be in a short-staffed situation and say, we're short-staffed today, and it's unfair. Now you have amplified responding. There's a patient who's using his calling light a lot, and he's a whiner, you have an amplified reaction to the stress. So it's helpful with a cognitive fusion to dissociate or try to separate out what is being objectively experienced and what is your mind contributing to that experience that's amplifying the stress. Experiential avoidance is the idea that you try to avoid coming into contact with the thoughts or feelings that are upsetting, even when doing so causes harm. So you try to ignore, distract. Oftentimes under condition of stress, people lose contact with the things that mean a lot to them, which create a sense of purpose. Because they're so focused on avoiding and escaping from stress, they lose a sense of meaning. And that is associated with inability to behave in accordance with values. They find themselves engaging in actions that are inconsistent with what they truly believe they should be doing. So what do we do about this? With mindfulness-based therapies, we have 3 points of intervention: those targeting thoughts, those targeting physiological responding, and those targeting behavioral responding. These are the different components. Acceptance is allowing yourself to experience fully the distressing thought while simultaneously engaging in a diffusing response, that is, noticing that you are amplifying the threat, amplifying the stressor through your own cognitive interpretations. The goal is not to control that, push it away, or make it be eliminated. The goal is to acknowledge it and welcome the thought, even when it is disturbing. And then the second component is to identify what is your purpose in that moment. What is it that you want to be doing that would be congruent with your values, and then to take action in accordance with that value. This is a very short presentation, and there's more to this, but the key components to mindfulness-based interventions are acceptance and willingness, diffusion, identifying values, and committed action. Research-wise, we've been doing research on this at Bowling Green and in other places. And this is what we found that helps us believe that these approaches can be effective. First off, we found in 2 studies that mindfulness predicts distress and caregiving risk for injury over and above a number of the conventional predictors. Meaning, when a nurse or a nurse aide is higher levels of non-mindfulness activity, that is, I mentioned before, thinking, this is terrible, this is awful, I can't take it, they're more likely to actually experience distress and objective injury. Mindfulness-based interventions also have been shown to improve or reduce distress levels and reduce the adverse impact of work stress. And all of these interventions don't involve trying to make the stress go away, but learning how to live with and accommodate to the stress. And then finally, currently we have a study that shows that, this is pretty remarkable, but it was an MTurk sample, but that 70% of current people in the responders to the survey had clinically significant PTSD symptoms, meaning they met criteria, and also high physical symptoms in the COVID-19. And that mindfulness, those who are higher on trait mindfulness and being able to sort of evaluate and view their cognitions without fusing with them, had significantly lower levels of symptoms. So altogether, the notion here is to work towards becoming aware of the thoughts and feelings, not trying to control them, but allow them to be present while you simultaneously pursue valued actions that are consistent with your long-range goals. And that's it for me. So I don't.
Claire, can you give me host back so I can post the?
Yeah, I'm going to try that. I'm new to this here system, so I'm trying to figure out a way to do that. I probably have to unshare first, right? Oh, a sign. Do I do a sign? Sign.
It shows that Claire Smith is the host, so she might need to do it.
Did I do it? Did I grant control?
I got control now.
Okay, good. Thanks.
Which I think. Actually, I'm not in control yet.
Oh.
Try Claire. Can you try to? It's Claire Smith that's the host still.
Oh, okay.
Now I'm the host.
Yeah.
I got it now.
Is there anybody that has any questions at this time? If you want to put it into the question and answer chat box, I will then read the questions for the panel, but you can certainly just ask questions. And I'll start off with one right now. I really enjoyed all your presentations. I think they really gave different components of all. But what do you think is the most pressing issue, giving, one of the big things that we have is so much right now is unknown. We can't quantify it, the uncertainty of it. We have the uncertainty of, and you talked about how the risk is what drives people on stress level a lot of times. But how do we end up understanding when there's so many variables right now that are totally not attainable? We can't even quantify them. So any of you can provide a response to that if you want.
I'll do a brief, there's two, I'll do a quick two-part answer to that. Part one is, if we do a straight out mindfulness, is we actually can't know. And so the idea is, I'll give you a quick illustration of another thing, and then we'll kind of come back to this. But sometimes I've worked with couples that one partner has cheated on the other partner, and they'll say, we need to have trust in our relationship now. We feel uncertainty. We feel a lack of trust. And what we say to them now is well, guess what we're not going to have? Every time you two sit down on the couch together, there's going to be you, your partner, and mistrust. Whenever his cell phone goes off, you're going to wonder, who is that? And there's not a thing I can do to make that not happen. Your relationship now has a new component to it, which is uncertainty. You can still have a healthy relationship and learn to not have it interfere with your relationship, but that has become a component of your life. I think we have that going on right now. We don't know. And so part of our situation is we have to, so when we sit down and watch TV or whatever, there's a part of our life that is just uncertain. We are all faced with the idea that we all might have an increased risk of dying at any one time on any given day. This has never happened to us before, but there's not enough research articles that will ever make that go away. So I do believe we have to the mindfulness, accept that that's the case, but not have it interfere with us doing the things that we value, that are important for us in life. So if we've got things to do that are important, we have to face that risk to do it, we have to do it. That's part one. And then the other part is, I do believe in science though, and I am a big fan of science. And I find great comfort in avoiding media reports of any scientific finding, but trying to go to the direct sources and find out what's really going on. And there's a lot of good information out there. There's information on prevalence, incidence, contractility, fatality rates that I find great comfort in, because it allows me to sort of more dispassionately evaluate my relative risk. So I can't know from day to day if I'm going to have something bad happen, but I can get an estimate, and the estimates are relatively favorable, right? I mean, the base rates are still fairly low. And so, yeah, that's my answer. Chime in, Claire.
Yeah, either one of you want to give your perspectives?
I was thinking from an organizational standpoint as well. Claire Barrett was kind of touching on this earlier, just the importance of good leadership. And yes, it's important to deal with it on an individual level and that type of uncertainty, but anything an organization can do to reduce some of that uncertainty, figure out what the main sources of stress are for their specific employees, receiving feedback from them, and then actually taking informed action to try and reduce that is going to be really important. So having leaders that step in, take measures, thinking about, physical safety right now, but additionally giving information about job security, kind of these larger issues that are looming over employees is going to be really, really important.
Yeah.
kind of piggyback on Claire's comment there. I mean, my big fear in all of this is this whole situation is very overwhelming for everybody. And then anybody working in healthcare is just that much more amplified because there's no escape from it. This is part of your job now to be constantly thinking about your safety and the safety of your patients. And so I guess a big concern for me is, you know, any organizational leaders, we're dealing with such few resources, a lot of demands, and I'm worried that it's going to be so overwhelming that they just kind of throw their hands up of. I mean, if you go to the literature, the single best way to improve the stress of healthcare workers is to increase staffing. And that's just probably not realistic for most organizations right now. We're dealing with a financial crisis. So it's kind of making sure that we, not just leaders, but employees, give them that empowerment to seek out resources and figure out what really works for them, but really kind of keying in on that communication component so that nobody's left kind of trying to figure this out on their own and displaying the behaviors that we really want our employees to show and not kind of giving up on trying to open up the conversation about stress and how we can try to help reduce it. Because that is a big fear. It's healthcare is stressful in any normal situation. And now you're adding in this pandemic and it just amplifies everything. And so it's a matter of not being overwhelmed by that prospect and trying to tackle the parts that you have ownership of, which is good leadership, good communication, giving your employees resources that you have access to help them get information and tools to effectively deal with their stress and perhaps conflict that their job creates with their family and personal lives.
You know, and I'd just like to, I agree, both Claires have great, at an organizational level, I think those are really, really helpful. I consult at a nursing home in Northwest Ohio, and one of the things that became a big workload issue for the nurse aides is all the patients are confined to their rooms. They can't leave their rooms. So they used to give them meals, for example, in a community dining room. They could go in and give meals to, 40 different patients, 5 aides, let's say, or 4 aides. That was doable. With each one in a separate room, their workload was dramatically increased, and the leadership there was good about it. They didn't hire anybody, but they took all the other staff that were not involved in patient care to help do meals. And that was very much appreciated by the nursing staff, and it was very helpful. So there may be very practical things that can be done too to reduce that uncertainty.
Sorry, I'm talking on mute, but is there any other questions before we wrap this up? That person had their hand raised earlier. I don't believe Jessica. I don't believe Katrina Jones has a question that was from earlier about, we will send out the link of this webinar. So we will get this out to be able to disseminate. So I would like to thank each of the panelists. This has been, like I said, a fantastic. I learned a lot from this. And I appreciate each of your times. And I'll certainly regroup back with you and thank you again through email. Appreciate it. And at this time, we'll convene this as being wrapped up. And hopefully everyone can stay safe and not be too stressed out there is what I got out of this. So, thank you for your time.
Thank you.
Thank you.